Very good evening to our Sir Mahathir. Today my group and I will be presenting about inflammatory bowel movement. So Disha will be the doctor, Yin will be the patient, and Kashmita will be the laboratories.
Hello, Ian. So I'm Dr. Disha here. I'll be with you throughout your treatment so you can seek for any help and you may ask any questions to me. So, yes, before we start, can I just have a few inquiries? This is our hospital formalities. So, can I know how long have you been having stool bleeding?
Yeah, for now, rectums and abdominals feel very painful, and then I slightly fever more than 2 days, diarrhea with bloods frequently, even from sleep. I don't have any allergy and no past surgical history. My family history. My mother have type 2 diabetes. Other family member they don't have any chronic disease, and I don't have any allergy.
Okay, alright. So, may I know when this thing started actually?
Actually, last 2 months I already start have these symptoms. I feel abdominal cramps, and I frequently go to the toilets or toilet after every meal, and with with blood my stool. So after that I collapsed at home and was admitted to another hospital. So that after 2 days I was discharged and without any diagnosis.
Okay. So, have you been seeking for any doctor or have you been to hospital previously?
So 1 month ago I go to the hospital again because the symptoms are still there, and I keep diarrhea and vomit. So I went to the hospital for rehydration and checking against is what problems in my body, but also didn't have any diagnosis.
Alright, okay, so nothing to worry for now. We'll be needing some specimen for us to identify what are you actually diagnosed with. So I'll be sending you for a few tests. First of all, you need to do a blood test and then stool test, and also you might need to do colonoscopy or endoscopy. This is because we need to see what are you diagnosed with. So to confirm your diagnosis, whether it's under infection or whether it's under any other bacteria or virus. So we need to do all these tests. You'll also be doing X-ray, okay? So hi Cash, I am actually Dr. Disha here. I've emailed to you regarding my patient's detail. Her name is Yin. So she just visited me today, and upon her symptoms, so I've been taking a few tests from her, which is like blood test, stool test, and also colonoscopy. So I really hope that I can receive very good information from you.
Yes, Dr. Disha. Good morning. This is Dr. Cash. Firstly, let me just confirm with you with the patient's details first. The patient's name is Miss A, age 25, and she lives from Malaysia. So based on her blood test results, her red blood cells count seems normal. As you can see here, it's normal. Her white blood cells normal. Her hemoglobin is normal. Her hematocrit level is normal. Her platelet count is normal. It's all within the range for the age of 25-year-old. And there's no signs of blood coagulation in her blood. All right, next. I will be moving on to the blood smear. However, based on the blood smear that was done, there are some defects on the red blood cells. As you can see here, some of the red blood cells are pencil shaped. Her platelets and white blood cells are completely normal. There are no defects or any shape malfunction. But there is also the presence of hypochromic microcytic red blood cells, microcytic red blood cells, hypochromic red cells, teardrop red blood cells, and also some of her red blood cells are target shaped. This is indicating that she is probably having anemia. Her type of anemia would be iron deficiency anemia. That's all. Thank you. Regarding to her stool sample, yeah. So based on the results, there is the presence of white blood cells or certain proteins in her stool. This indicates ulcerative colitis. The white blood cells and the protein known as calprotein may cause the ulcer. That's it. Thank you.
Hi Mita, I'm Dr. Disha here. I've emailed to you regarding my patient's details. Her name is Yin. So can you just check with her colonoscopy results and let me know?
Yes, Dr. Disha, this is Dr. Mita. Let me just go through the particulars of the patient. Firstly, the patient's name is Miss Yin, age 25, from Malaysia. Alright, she's experiencing some symptoms that might be related to her intestine, which are diarrhea, abdominal pain, and rectal pain. Alright, so based on the CT scan, as you can see here, she has inflammation on the middle part of the large intestine. As you can see, the white color part of the CT scan shows there's inflammation, and then joining to the rectum, the starting of the rectum and the lower part of the large intestine. Alright, now moving on to the colonoscopy scan. The colonoscopy scan that was done shows that she's having ulcer inside her large intestine, which is continuing to the rectum. This may result to bloody diarrhea. That's it, I guess. Thank you.
Hello Yin, so nice to meet you again. Hope you're doing good, okay? So I've been discussing with both of the laboratories and also my nurse. You have been diagnosed with inflammatory bowel disease. So this is because there's no any main causes for this disease. So we've probably identified that this is due to your stool bleeding, which is continuously happening, and also a few symptoms. So first and foremost, let me just explain to you what is actually this inflammatory bowel disease. So there are two categories under it, which is Crohn's disease and also ulcerative colitis. So yours is diagnosed under ulcerative colitis. So this is because of prolonged inflammation in your gastrointestinal tract. So the inflammation in your gastrointestinal tract causes your stool to bleed, and also abdominal pain, and also cough a few times, and also non-stop diarrhea. So the symptoms that you went through, okay, so that is all related to this. So Yin, this actually has been happening in your large intestine, which is the main reason for you to have stool bleeding. Not only that, but this also have treatment, so you don't have to be worried about it. Yes, it is a chronic disease, but then it can be treated, okay? So I'll be giving you a few prescribed medicine, like steroids, and also a few medications which you can do. Other than this medication, you also have surgery choice, which you can actually do if this thing is prolonged. So we will be removing the part where it's damaged, so you can actually seek for the surgery. But then for now, we've not been doing surgery because most of the cases are actually treated in medication wise. So other than that, you can also actually do exercises. Do not eat any spicy food for now. Control your food habits, okay? So you can eat more almonds. So just control your food habits. This is one of the factor, okay, to have inflammatory bowel disease such as ulcerative colitis. Okay, so for further information, there are actually 5 stages for inflammatory bowel disease, which are: the first one is to stage the disease. To know whether this disease is actually very prolonged or can it be treated, how long is it been affected to the patient. Secondly is to stratify the patient. So we should know whether the patients are undergoing a deep colonic ulcer or also gastrointestinal disease, rectal disease, so many factors which can affect this IBD. So this is the risk factors, like mainly small bowel disease. And then thirdly, we have to set a treatment for the patient. Set an appropriate treatment. Do not just give a prescribed medication which do not help the inflammatory to cool down. So you may give any drugs related medications such as steroids, which may help to actually decrease the bacterial infection, antibiotic which can reduce the inflammation, and also diarrhea. So all this is actually helping to IBD. And also therapy, because there is not only specific to medication, you can also do anything outside of medication which may help. Do not get worried, okay? There's solution for everything, and I'm sure that you will get well soon. So don't worry, you may just contact me anytime. You'll be discharged in another 2 to 3 days. So hope you will be okay. Alright? Thank you.
So hi guys, this is Dr. Kashmita, and here's some tips and tricks that can be useful for you during laboratory diagnostics. Firstly, this is a basic procedure of a peripheral blood smear. Firstly, place a clean slide on a flat surface. Add 1 small drop of blood to the end. Take another clean slide and holding it at an angle of 45 degrees. Touch the blood with one end of the slide so the blood runs along the edge of the slide by capillary action. Push carefully along the length of the first slide to produce a thin blood smear. Step 3. Make 2 smears, allow them to dry and label them clearly. Once dry, place it in the provided slide transport containers. So this is an image of how a laboratory technician does blood smear. So why blood smear? Why do laboratory technicians do blood smear? Normally, a blood smear is done when venipuncture results provide normal, which is within the range of the patient's age limit. Secondly, a blood smear is a sample of blood that's tested on a specially treated slide. For a blood smear test, a laboratory professional examines the slide under a microscope and looks at the size or shape and the number of different types of cells present in the blood. Those cells include red blood cells, white blood cells, and also platelet. So the next step that was taken account was the stool culture. The stool culture is a test that detects and identifies bacteria that causes infections of the lower digestive tract. The test distinguishes between the types of bacteria that causes disease, such as pathogenic disease, and the types that are normally found in the digestive tract or known as normal flora. The test helps to determine if the pathogenic bacteria are the cause of the person's gastrointestinal symptoms or gastroenteritis. McConkey's orbital media is a normal culture that is used to culture grossly blurred stool specimens. Stool culture test results usually take 2 to 3 days before diagnostics. If a stool culture is positive for pathogenic bacteria, then they are most likely causing the person to experience symptoms such as diarrhea, abdominal pain, and smoke. Results are frequently reported out with the name of pathogenic bacteria if there was one detected. So this is an image of how stool samples are kept in the laboratory. Thank you. That's all from my.
Colitis is a chronic inflammatory disease. The number of people with this disease are increased rapidly. Normally, medical manage although 10% to 15% of patients require a colostomy. The goals of care are to induce and maintain remissions, reduce the risk of complication, and improve quality of life. Primary care physicians play a key role in managing these patients to reduce their risk of complication, being aware of the preventive interventions and the potential complications of the pharmacotherapy is critical to optimizing the health care of patients with ulcerative colitis.
Thank you for watching, Sir Mahathir.